SIDS, that means sudden infant death syndrome. Sudden infant death syndrome is the unexplained death, usually during sleep, of a seemingly healthy baby less than a year old. SIDS is the sometimes known as crib death because the infant often die in their cribs. Although the cause is unknown, but it appears that SIDS might be associated with defect in the portion of an infant's brain that control the breathing and arousal from the sleep. Now, what are causes? Some are physical factors like brain defects. Some infants are born with problems that make more likely to die for SIDS. Low birth weight, premature birth, or being a part of multiple birth increases the likelihood that a baby's brain hasn't matured completely. Respiratory infection. Many infants who died of SIDS have recently had a cold, which might contribute to breathing problems. Sleeping environmental factors like the items in a baby's crib and his or her sleeping position can combine with a baby's physical problems to increase the risk of SIDS. Example like sleeping on the stomach or side. Babies placed in these position to sleep might have more difficult breathing. Sleeping on a soft surface, sharing a bed, or overheating. Being too warm while sleeping can increase the baby's risk of SIDS. What are the risk factors? Risk factors are sex. In boys are slightly more likely to die of SIDS as compared to girls. Age. Infants are most vulnerable between the second and fourth month of life. Family history. Babies who have had siblings or cousins die of SIDS are at higher risk of SIDS. That means positive family history. Then being premature, both being born earlier, having a low birth weight increase your baby's chance of SIDS. Then smoking is also a risk factor. Maternal risk factor is if mother is younger than 20, smoke cigarette, use drugs or alcohol, or has inadequate prenatal care. How to prevent? Uh, there is no guaranteed way to prevent acid, but you can help your baby sleep more safely by following tips like back to sleep. Place your baby to sleep on his or her back rather than on the stomach or side every time you. Keep the crib as bare as possible. Use a firm mattress and avoid placing your baby on thick, fluffy padding. Don't overheat your baby to keep your baby warm. Try a sleep sack or other sleep clothing. Have your baby sleep in your room. Breastfeed your baby if possible. Breastfeeding for at least 6 months lower the risk of SIDS. Don't use baby monitors and other commercial devices that claim to reduce the risk of SIDS. Immunize your baby. Like there is no evidence that routine immunization increases SIDS risk. Some evidence indicate immunization can have prevent SIDS. So that's all about